Question 1. System analysis indicates that a physical therapist is evaluating a patient presenting with acute inflammation in the shoulder joint. The patient reports significant pain with passive range of motion and has a goal of improving shoulder mobility. The therapist is considering various flexibility and stretching techniques. Which of the following approaches best aligns with the principles of safe and effective physical therapy practice in this scenario? Option A. Implement gentle, passive range of motion exercises within the patient's pain-free limits and consider isometric exercises to maintain muscle activation without stressing the inflamed joint. Option B. Apply ballistic stretching techniques to rapidly increase the range of motion, as this is often effective for overcoming stiffness. Option C. Advise the patient to rest completely and avoid any form of stretching until the inflammation has fully resolved, even if it leads to significant stiffness. Option D. Perform aggressive static stretching for prolonged durations to force the tissues into a greater range of motion, overriding the patient's pain signals. Correct answer is A. Implement gentle, passive range of motion exercises within the patient's pain-free limits and consider isometric exercises to maintain muscle activation without stressing the inflamed joint. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a physical therapist must select the most appropriate flexibility technique for a patient with a specific condition and contraindication. The challenge lies in balancing the therapeutic goals of improving range of motion with the imperative to avoid exacerbating the patient's existing pathology. A physical therapist must possess a thorough understanding of various stretching modalities, their physiological effects, and the specific precautions associated with different medical conditions. Failure to do so can lead to patient harm, reduced therapeutic outcomes, and potential legal or ethical repercussions. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's condition, including identifying any contraindications to specific stretching techniques. Based on this assessment, the physical therapist selects a technique that is both effective for improving flexibility and safe for the patient. For a patient with acute inflammation, techniques that involve gentle, passive range of motion or isometric stretching, which do not further irritate the inflamed tissues, are generally preferred over aggressive or ballistic stretching. This aligns with the principle of do no harm, non-maleficence, and the ethical obligation to provide evidence-based care tailored to the individual patient's needs and limitations, as mandated by the standards of practice for physical therapists. Incorrect approaches analysis. One incorrect approach would be to apply a standard, aggressive stretching protocol without considering the patient's acute inflammatory condition. This violates the principle of non-maleficence by potentially increasing pain, inflammation, and tissue damage. It also fails to adhere to the ethical standard of individualized care and could be considered negligent practice. Another incorrect approach would be to avoid all stretching due to the presence of inflammation, even if gentle techniques could be beneficial for maintaining range of motion and preventing stiffness. This could be considered a failure to provide appropriate care and may lead to secondary complications, such as joint stiffness and decreased function, which is contrary to the physical therapist's role in promoting optimal patient outcomes. A third incorrect approach would be to rely solely on patient self-report of pain, without objective assessment to guide the selection of stretching techniques. While patient feedback is crucial, a physical therapist must also use their clinical judgment and knowledge of anatomy and physiology to determine the safety and efficacy of a technique, especially when contraindications are present. Over-reliance on subjective reporting without objective evaluation can lead to inappropriate treatment decisions. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient evaluation, including a detailed history, physical examination, and identification of any contraindications or precautions. This is followed by the formulation of a treatment plan that prioritizes patient safety and therapeutic goals. The selection of interventions, such as flexibility techniques, should be based on current evidence and the patient's specific presentation. Regular reassessment and modification of the treatment plan based on the patient's response are essential components of effective and ethical physical therapy practice. Question 2. The performance metrics show a patient's heart rate increasing by 30 beats per minute and their respiratory rate increasing by 8 breaths per minute during a moderate intensity exercise bout. The patient reports feeling a little winded, but denies any chest pain or dizziness. Which of the following best describes the appropriate physical therapist's interpretation and subsequent action? Option A. Continue the exercise at the current intensity, as the observed physiological responses are within expected parameters for moderate exertion, and the patient's subjective report does not indicate significant distress. Option B. Focus solely on the heart rate increase, aiming to maintain it within a specific target zone, and disregard the respiratory rate and subjective feedback as secondary indicators. Option C. Immediately terminate the exercise session and recommend further cardiac evaluation, as any increase in respiratory rate beyond 5 breaths per minute during exercise is an absolute contraindication. Option D. Advise the patient to reduce the exercise intensity by 50% to ensure their cardiovascular system is not being overstressed, regardless of their subjective report. The correct answer is A. Continue the exercise at the current intensity, as the observed physiological responses are within expected parameters for moderate exertion, and the patient's subjective report does not indicate significant distress. Explanation: this scenario presents a common challenge in physical therapy, interpreting and applying objective data to guide patient care. The professional challenge lies in understanding the physiological implications of exercise on cardiovascular and respiratory systems, and how these changes relate to a patient's functional capacity and safety. A physical therapist must move beyond simply observing numbers to understanding the underlying mechanisms and potential risks or benefits for the individual patient. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of exercise physiology and its application within the scope of physical therapy. It involves integrating objective data with clinical judgment, considering the patient's specific condition, goals, and potential contraindications. This aligns with the core principles of evidence-based practice and patient-centered care, which are fundamental to the National Physical Therapy Examination's emphasis on safe and effective practice. Regulatory frameworks for physical therapy emphasize the therapist's responsibility to assess, plan, and implement interventions based on sound clinical reasoning and an understanding of physiological responses to exercise. An incorrect approach that focuses solely on achieving a specific numerical target without considering the patient's overall response or potential risks would be professionally unacceptable. This could lead to overexertion, exacerbation of underlying conditions, or failure to identify subtle signs of distress, thereby violating the ethical and regulatory duty to provide safe and appropriate care. For instance, pushing a patient to reach a target heart rate that is too high for their current cardiovascular status could lead to adverse events, a direct contravention of the principle of do no harm and the regulatory requirement for competent practice. Another incorrect approach might involve ignoring subjective patient feedback, such as reports of dizziness or shortness of breath, in favor of objective data, which would be a failure to consider the holistic patient presentation and could lead to misdiagnosis or inappropriate treatment progression. This disregards the ethical obligation to respect patient autonomy and their subjective experience of their condition. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly review all available performance metrics and patient subjective reports. Second, interpret these findings within the context of the patient's diagnosis, medical history, and established exercise guidelines. Third, consider potential physiological responses and risks associated with the observed data. Fourth, formulate a clinical decision that prioritizes patient safety, functional improvement, and adherence to ethical and regulatory standards. Finally, document the rationale for the chosen course of action clearly and comprehensively. Question 3. The control framework reveals a physical therapist managing a chronic wound exhibiting signs of maceration and slough. The patient has been using a hydrocolloid dressing for the past 2 weeks with minimal improvement. The therapist must decide on the next course of action to promote healing. Which of the following approaches best reflects best professional practice in this scenario? Option A. Reassess the wound thoroughly to identify the underlying cause of maceration and slough, and select a dressing that manages exudate effectively while promoting autolytic debridement. Option B. Remove the hydrocolloid dressing and leave the wound open to air to promote drying. Option C. Immediately apply a silver-impregnated dressing to address potential underlying infection without further assessment. Option D. Continue with the hydrocolloid dressing, assuming the wound requires more time to respond to the current treatment. The correct answer is A. Reassess the wound thoroughly to identify the underlying cause of maceration and slough, and select a dressing that manages exudate effectively while promoting autolytic debridement. Explanation. This scenario presents a common implementation challenge in wound care, where a physical therapist must balance evidence-based practice with patient-specific factors and the practicalities of available resources. The challenge lies in selecting the most appropriate dressing for a complex wound that exhibits signs of delayed healing, requiring a nuanced understanding of wound bed preparation and the physiological stages of healing. Careful judgment is required to avoid interventions that could exacerbate the wound's condition or hinder its progression through the healing cascade. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based assessment of the wound's current state. This involves identifying the specific barriers to healing, such as excessive exudate, non-viable tissue, or potential infection, and then selecting a dressing that directly addresses these issues. This aligns with the principles of physical therapy practice, which mandate patient-centered care, the application of scientific knowledge, and the continuous evaluation of treatment efficacy. Adhering to established guidelines for wound management, such as those promoted by the National Physical Therapy Examinations Regulatory Framework, ensures that interventions are safe, effective, and ethically sound. An incorrect approach that involves simply reapplying the same dressing without reassessing the wound status fails to acknowledge the dynamic nature of wound healing. This could be considered a regulatory failure, as it deviates from the expectation of skilled and informed professional judgment, potentially leading to prolonged healing times or complications. Another incorrect approach, such as immediately escalating to a more aggressive treatment without a thorough assessment, might be an ethical failure if it exposes the patient to unnecessary risks or costs without sufficient justification. Furthermore, relying solely on anecdotal evidence or personal preference over established protocols would represent a failure to adhere to the scientific basis of physical therapy practice. The professional decision-making process for similar situations should involve a structured approach. First, conduct a comprehensive wound assessment, including visual inspection, palpation, and consideration of patient history and systemic factors. Second, identify the primary barriers to healing. Third, consult current evidence-based guidelines and literature to determine appropriate interventions. Fourth, select the most suitable treatment, considering patient goals, preferences, and available resources. Fifth, implement the chosen intervention and continuously monitor the wound's response, adjusting the plan as needed. This iterative process ensures that care remains responsive to the patient's evolving needs and promotes optimal outcomes. Question 4. Stakeholder feedback indicates that some physical therapy students struggle with accurately documenting joint types and their associated movements in patient charts. A physical therapist is assessing a patient's elbow and observes typical flexion and extension. Which of the following descriptions of the elbow joint and its movements would be considered the most accurate and professionally appropriate for documentation? Option A. Pivot joint, with primary movements of abduction and adduction. Option B. Hinge joint with primary movements of flexion and extension. Option C. Saddle joint with gliding and sliding movements. Option D. Ball and socket joint with movements of circumduction and rotation. The correct answer is B. Hinge joint with primary movements of flexion and extension. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a physical therapist to accurately identify and describe joint types and their associated movements in a patient's medical record. Misidentification or inaccurate descriptions can lead to miscommunication among healthcare providers, inappropriate treatment planning, and potentially suboptimal patient outcomes. The challenge lies in translating clinical observation and assessment into precise, standardized terminology that aligns with anatomical and biomechanical principles, as well as regulatory requirements for documentation. Correct approach analysis. The correct approach represents best professional practice because it demonstrates a thorough understanding of anatomical terminology and the classification of synovial joints. Specifically, identifying a hinge joint and its primary movement, flexion/extension, is accurate for the elbow. This precision in documentation is crucial for maintaining clear communication within the healthcare team, ensuring continuity of care, and adhering to professional standards for record keeping as mandated by the National Physical Therapy Examinations Regulatory Framework, which emphasizes accurate and objective patient documentation. Incorrect approaches analysis. An approach that describes the joint as a ball and socket joint and its movements as circumduction and rotation is incorrect because the elbow is not a ball and socket joint. It is a hinged joint. Ball and socket joints, like the shoulder or hip, allow for a much greater range of motion. This misclassification represents a failure in fundamental anatomical knowledge and would lead to inaccurate charting, potentially misguiding subsequent treatment or diagnostic efforts. It violates the ethical obligation to provide competent care and accurate documentation. An approach that labels the joint as a pivot joint and lists abduction and adduction as its primary movements is incorrect because the elbow is primarily a hinge joint, not a pivot joint. Pivot joints, such as the atlantoaxial joint in the neck, allow for rotational movement. Abduction and adduction are movements typically associated with the appendicular skeleton, like the shoulder or hip. This misidentification demonstrates a lack of understanding of joint classification and function, leading to erroneous documentation and potentially inappropriate therapeutic interventions. An approach that classifies the joint as a saddle joint and describes gliding and sliding movements is incorrect because the elbow does not possess the saddle joint's characteristic reciprocal concave and convex surfaces, nor are gliding and sliding its primary movements. Saddle joints, like the carpometacarpal joint of the thumb, allow for biaxial movement. This misclassification indicates a significant deficit in anatomical knowledge and would result in misleading patient records, undermining the integrity of the healthcare process and potentially compromising patient safety. Professional reasoning. When faced with documenting joint assessments, a physical therapist should employ a systematic decision-making process. This involves 1. Performing a thorough physical examination to assess the joint structure and observed movements. 2. Recalling or referencing established anatomical classifications of synovial joints, hinge, pivot, saddle, condyloid, ball and socket, plane. 3. Accurately identifying the specific type of joint based on its structural characteristics and typical range of motion. 4. Using precise, standardized terminology to describe the joint and its primary movements, e.g., flexion, extension, abduction, adduction, rotation, circumduction, gliding. 5. Ensuring all documentation is objective, accurate, and consistent with professional standards and regulatory requirements for patient records. Question 5. Market research demonstrates a growing demand for outpatient physical therapy services focused on improving functional capacity in individuals with chronic obstructive pulmonary disease, COPD. A physical therapist is preparing to initiate a new group exercise program for these patients. Which of the following initial steps is most critical for ensuring patient safety and optimizing therapeutic outcomes within the regulatory framework governing physical therapy practice in the United States? Option A. Conduct a comprehensive pre-program assessment for each participant, including a detailed medical history, review of current medications, assessment of functional limitations, and objective measures of cardiopulmonary function, e.g., vital signs, oxygen saturation at rest and with exertion, and exercise tolerance testing. Option B. Immediately begin moderate-intensity aerobic exercise for all participants to quickly improve cardiovascular endurance, as this is a primary goal for COPD management. Option C. Develop a standardized exercise protocol based on general guidelines for COPD patients and implement it uniformly across all participants to ensure consistency and efficiency. Option D. Rely primarily on patients' self-reported exertion levels and comfort during exercise sessions to guide intensity and progression, assuming patients are the best judges of their limits. The correct answer is A. Conduct a comprehensive pre-program assessment for each participant, including a detailed medical history, review of current medications, assessment of functional limitations, and objective measures of cardiopulmonary function, e.g., vital signs, oxygen saturation at rest and with exertion, and exercise tolerance testing. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in patient response to exercise interventions for cardiovascular and respiratory conditions. Physical therapists must balance the need for effective treatment with the imperative to ensure patient safety, especially when dealing with individuals who may have compromised cardiopulmonary function. The challenge lies in accurately assessing risk, individualizing the treatment plan, and adapting it dynamically based on real-time patient feedback and objective measures, all while adhering to professional standards and regulatory guidelines. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized, and evidence-based assessment prior to initiating any intervention. This aligns with the core principles of patient-centered care and the legal and ethical obligations of physical therapists to practice within their scope and competence. Specifically, it reflects the requirement to obtain informed consent, which necessitates a thorough explanation of the proposed treatment, its potential benefits, risks, and alternatives. Furthermore, it underscores the importance of a baseline assessment to establish a safe starting point and to monitor progress effectively, thereby minimizing the risk of adverse events and maximizing therapeutic outcomes. This approach is directly supported by the standards of practice set forth by the relevant professional bodies governing physical therapy in the United States, which mandate thorough evaluation and individualized treatment planning. Incorrect approaches analysis. One incorrect approach fails to conduct a thorough baseline assessment of cardiovascular and respiratory function. This is a direct violation of professional standards that require a comprehensive evaluation to identify contraindications and precautions. Practicing without this foundational knowledge significantly increases the risk of harm to the patient, potentially leading to exacerbation of their condition or acute medical events. This constitutes negligence and a failure to meet the duty of care owed to the patient, which is a cornerstone of professional liability and ethical conduct. Another incorrect approach involves proceeding with a standardized, one-size-fits-all exercise program without considering the patient's specific limitations, comorbidities, or subjective feedback. This demonstrates a lack of clinical reasoning and an abdication of the therapist's responsibility to individualize care. Such an approach ignores the unique physiological responses of each patient and can lead to undertreatment or overtreatment, both of which are detrimental to patient outcomes and violate the ethical principle of beneficence. It also fails to comply with the regulatory expectation that interventions be tailored to the individual's needs and capabilities. A third incorrect approach is to rely solely on patient self-report without objective physiological monitoring during exercise. While patient feedback is crucial, it must be corroborated with objective data, especially in cardiopulmonary rehabilitation. Ignoring objective measures like heart rate, blood pressure, and oxygen saturation can lead to a false sense of security or an underestimation of exertion, potentially placing the patient at risk. This approach demonstrates a failure to utilize the full spectrum of assessment tools available and a disregard for the established safety protocols in cardiopulmonary physical therapy, which are often implicitly or explicitly required by regulatory bodies to ensure patient safety. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the patient's condition and goals. This involves gathering subjective information, patient history, symptoms, and objective data, physical examination, diagnostic tests. Based on this comprehensive assessment, the therapist must then formulate a differential diagnosis and develop an individualized, evidence-based treatment plan. This plan should clearly outline the proposed interventions, their rationale, expected outcomes, and a strategy for monitoring progress and managing potential risks. Throughout the treatment, continuous reassessment and adaptation of the plan based on the patient's response are paramount. This iterative process ensures that the care provided is safe, effective, and aligned with professional and regulatory expectations. Question 6. Cost-benefit analysis shows that a thorough neuroanatomical and neurophysiological assessment is crucial for effective patient management, especially when symptoms suggest a complex neurological presentation. A physical therapist is presented with a patient reporting progressive weakness and sensory changes in the upper extremity. The therapist must determine the most appropriate initial course of action. Which of the following approaches best reflects best professional practice in this scenario? Option A. Rely solely on the patient's subjective report of symptoms to guide the selection of interventions. Option B. Refer the patient to a neurologist without conducting any preliminary physical or neurological assessment. Option C. Perform a comprehensive neurological examination, including assessment of reflexes, muscle strength across multiple myotomes, dermatomal sensation, and specific tests for peripheral nerve integrity and central nervous system involvement. Option D. Immediately initiate a broad-spectrum exercise program, targeting general upper extremity strengthening and flexibility. Correct answer is C. Perform a comprehensive neurological examination, including assessment of reflexes, muscle strength across multiple myotomes, dermatomal sensation, and specific tests for peripheral nerve integrity and central nervous system involvement. Explanation. Scenario analysis. This scenario presents a common challenge in physical therapy practice where a patient exhibits symptoms that could stem from multiple neurological pathways. Differentiating between a central nervous system lesion and a peripheral nerve issue requires a thorough understanding of neuroanatomy and neurophysiology. The challenge lies in accurately identifying the origin of the deficit to ensure the most effective and safe treatment plan is implemented, avoiding potential harm or ineffective interventions. Correct approach analysis. The correct approach involves a systematic evaluation that begins with a comprehensive patient history and observation, followed by targeted physical examination maneuvers designed to isolate specific neurological structures. This includes assessing reflexes, muscle strength, sensation, coordination, and proprioception, correlating findings with known neuroanatomical pathways. For example, testing for a specific dermatome or myotome can help pinpoint a spinal nerve root or peripheral nerve lesion, while assessing for cranial nerve deficits or central motor control patterns would point towards a central origin. This methodical approach aligns with the principles of evidence-based practice and the APTA Code of Ethics, which mandate competent and ethical patient care, requiring physical therapists to possess and apply advanced knowledge of neuroanatomy and neurophysiology to diagnose and treat patients effectively. Incorrect approaches analysis. An approach that solely relies on superficial observation without a systematic neurological examination fails to adhere to professional standards. This could lead to misdiagnosis, as symptoms can be misleading. Ethically, this represents a failure to provide competent care as outlined by Professional Practice Acts and APTA guidelines, potentially violating the principle of beneficence by not acting in the patient's best interest. Another incorrect approach would be to immediately initiate a treatment protocol based on a presumed diagnosis without adequate objective assessment. This bypasses the critical diagnostic phase and could result in the application of inappropriate interventions, potentially exacerbating the patient's condition or delaying appropriate care. This violates the ethical principle of non-maleficence, do no harm, and demonstrates a lack of professional accountability. A third incorrect approach might involve referring the patient to a specialist without first performing a basic neurological screen. While referrals are sometimes necessary, a physical therapist is expected to have the foundational knowledge to perform an initial assessment and gather sufficient information to guide the referral appropriately. Failing to do so may indicate a deficiency in core competencies and a missed opportunity to provide immediate, appropriate care. Professional reasoning. Professionals should approach such cases by first gathering subjective information from the patient about the onset, nature, and progression of symptoms. This is followed by objective assessment, starting with general observation and progressing to specific tests that probe different components of the nervous system. The findings are then integrated with knowledge of neuroanatomy and neurophysiology to formulate a differential diagnosis. Treatment planning is then based on this diagnosis, with ongoing reassessment to monitor progress and adjust interventions as needed. This iterative process ensures patient safety, optimizes treatment efficacy, and upholds professional standards. Question 7. Risk assessment procedures indicate that a patient scheduled for a therapeutic exercise program exhibits a significant area of reddened, non-blanchable skin with blistering on the sacrum, which was not noted in previous documentation. The physical therapist is concerned about the potential for further skin breakdown and infection. Which of the following actions best reflects adherence to regulatory and ethical standards for physical therapists? Option A. Advise the patient to apply a topical ointment to the area and proceed with the exercises, as this is a common home remedy. Option B. Proceed with the planned therapeutic exercise program as scheduled, assuming the skin condition is minor and will not be exacerbated by the exercises. Option C. Consult with the referring physician or appropriate healthcare provider regarding the skin condition and its implications for the planned physical therapy intervention, documenting the consultation and any resulting treatment modifications. Option D. Ignore the skin condition and focus solely on the patient's functional deficits, as the primary goal is to improve mobility. Correct answer is C. Consult with the referring physician or appropriate healthcare provider regarding the skin condition and its implications for the planned physical therapy intervention, documenting the consultation and any resulting treatment modifications. Explanation. Scenario analysis. This scenario presents a common challenge in physical therapy where a patient's skin integrity is compromised, directly impacting the ability to provide safe and effective treatment. The physical therapist must balance the need to address the patient's functional deficits with the imperative to prevent further harm, specifically infection and delayed healing. The challenge lies in accurately assessing the severity of the skin condition, understanding its underlying causes, and determining the appropriate course of action within the scope of physical therapy practice and regulatory guidelines. Correct approach analysis. The correct approach, which involves consulting with the referring physician or appropriate healthcare provider regarding the skin condition and its implications for the planned physical therapy intervention, represents best professional practice. This aligns with the National Physical Therapy Examination's emphasis on patient safety and interprofessional collaboration. Regulatory frameworks and ethical guidelines for physical therapists mandate that practitioners operate within their scope of practice and seek consultation when faced with conditions that may exceed their expertise or pose a significant risk to the patient. Documenting this consultation and the resulting treatment modifications is crucial for legal and ethical compliance, ensuring continuity of care and informed decision-making. Incorrect approaches analysis. Proceeding with the planned treatment without addressing the skin condition ignores the fundamental principle of do no harm, non-maleficence, a cornerstone of healthcare ethics. This could lead to exacerbation of the skin breakdown, infection, and delayed wound healing, constituting a breach of professional duty and potentially violating state practice acts that define the scope of physical therapy. Ignoring the skin condition and focusing solely on the patient's functional deficits without considering the compromised integumentary system is negligent. It demonstrates a failure to perform a comprehensive patient assessment, which is a regulatory requirement for all licensed healthcare professionals. This approach disregards the interconnectedness of bodily systems and the potential for systemic complications arising from localized skin issues. Assuming the skin condition will resolve on its own without intervention or consultation is a passive and potentially dangerous approach. It abdicates the therapist's responsibility to actively manage patient care and advocate for their well-being. This failure to act proactively can result in adverse patient outcomes and professional misconduct, as it deviates from the expected standard of care. Professional reasoning. When faced with a patient presenting with a skin condition that may impact planned interventions, a physical therapist should employ a systematic decision-making process. This begins with a thorough assessment of the skin, noting its appearance, location, extent, and any associated symptoms. The therapist must then consider their scope of practice and expertise in managing such conditions. If the condition is beyond their purview or poses a significant risk, the immediate next step is to consult with the referring physician or an appropriate healthcare provider. This ensures that the patient receives the most appropriate medical management for their skin condition, and that the physical therapy plan is safely integrated into the overall care plan. Documentation of the assessment, consultation, and any modifications to the treatment plan is paramount for accountability and continuity of care. Question 8. The efficiency study reveals that a physical therapist is treating a patient for chronic low back pain. During the session, the patient reports experiencing new, severe headaches and intermittent visual disturbances that have been present for the past week. The physical therapist recognizes these symptoms are not typical of musculoskeletal conditions and may indicate a neurological or other systemic issue requiring medical evaluation. What is the most appropriate course of action for the physical therapist in this situation, adhering to the scope of practice and professional standards for physical therapists? Option A. Attempt to manage the headaches and visual disturbances using general pain management techniques learned in their physical therapy education without consulting a physician. Option B. Advise the patient that the headaches and visual disturbances are outside the scope of physical therapy and dismiss them from care until these symptoms resolve. Option C. Immediately refer the patient to a neurologist for further evaluation of the headaches and visual disturbances, while continuing to manage the patient's low back pain within the scope of physical therapy. Option D. Continue with the planned treatment for low back pain, advising the patient to monitor the headaches and visual disturbances and to see their primary care physician if they worsen. The correct answer is D. Continue with the planned treatment for low back pain, advising the patient to monitor the headaches and visual disturbances and to see their primary care physician if they worsen. Explanation. Scenario analysis. This scenario presents a professional challenge where a physical therapist must navigate the boundaries of their scope of practice when encountering a patient exhibiting symptoms outside their direct expertise. The challenge lies in balancing the patient's immediate need for care with the therapist's ethical and legal obligations to practice within their defined competencies and to ensure appropriate referral when necessary. Misjudgment can lead to patient harm, professional misconduct, and legal repercussions. Correct approach analysis. The correct approach demonstrates adherence to the core principles of professional physical therapy practice as outlined by the National Physical Therapy Examination (NT) regulatory framework. This includes recognizing the limits of one's expertise, prioritizing patient safety, and acting in the patient's best interest by facilitating appropriate referral. This approach upholds the ethical obligation to provide competent care and the legal requirement to practice within the scope of licensure. It reflects a commitment to interprofessional collaboration and patient advocacy, ensuring the patient receives the most appropriate and effective care. Incorrect approach is analysis, an approach that involves attempting to manage the patient's symptoms without consulting a physician or specialist, despite recognizing the potential for a condition outside the physical therapist's scope, represents a failure to adhere to the principle of practicing within one's defined scope. This could lead to delayed diagnosis and treatment of a serious underlying condition, potentially causing harm to the patient. It also violates the ethical duty to refer when a condition is beyond the therapist's expertise. Another incorrect approach would be to dismiss the patient's symptoms as unrelated to physical therapy without further investigation or consultation, especially if there is any indication of a potentially serious underlying issue. This demonstrates a lack of due diligence and could result in a misdiagnosis, which is a significant ethical and professional failing. It prioritizes expediency over thorough patient assessment and care. Finally, an approach that involves providing general advice or interventions that are not specifically tailored to the patient's presenting physical therapy needs, without addressing the concerning symptoms or referring, is also professionally unsound. This approach fails to adequately address the patient's overall health status and could be interpreted as practicing outside the scope of physical therapy by offering advice on matters that require medical expertise. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment. If during this assessment, symptoms or conditions arise that fall outside the physical therapist's defined scope of practice or expertise, the immediate next step should be to consult with the patient's physician or refer the patient to an appropriate medical specialist. This process prioritizes patient safety, ensures adherence to legal and ethical standards, and promotes collaborative healthcare. Documentation of the assessment findings, the decision-making process, and any referrals made is crucial for professional accountability. Question 9. Cost-benefit analysis shows that allowing a patient with a history of falls and mild cognitive impairment to independently ambulate in a busy hospital hallway without supervision presents a significant risk of re-injury, yet the patient adamantly insists on this activity to maintain their sense of independence. The physical therapist must decide how to proceed. Which of the following represents the most ethically and legally sound approach? Option A. Proceed with supervised ambulation in the hallway as planned, but do not explicitly discuss the increased risks associated with their cognitive impairment and fall history, assuming the patient understands. Option B. Engage the patient in a detailed discussion about the identified risks of unsupervised ambulation in the hallway, explore their motivations for independence, and collaboratively develop a modified plan that may include supervised ambulation with a walker for a set duration, or ambulation in a safer, less stimulating environment, while clearly documenting the risks and the patient's informed decision. Option C. Immediately prohibit the patient from ambulating in the hallway unsupervised, citing the risk of falls and potential liability, and insist on supervised ambulation only within the therapy gym. Option D. Allow the patient to ambulate unsupervised in the hallway as they wish, prioritizing their expressed desire for independence over the therapist's concerns about safety, and document their request. The correct answer is B. Engage the patient in a detailed discussion about the identified risks of unsupervised ambulation in the hallway, explore their motivations for independence, and collaboratively develop a modified plan that may include supervised ambulation with a walker for a set duration, or ambulation in a safer, less stimulating environment, while clearly documenting the risks and the patient's informed decision. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the physical therapist's professional judgment regarding their safety and functional outcomes. The physical therapist must navigate the ethical principles of autonomy, respecting the patient's right to make decisions about their care, and beneficence, acting in the patient's best interest to promote well-being and prevent harm. Legally, the physical therapist is bound by the standards of care established by the profession and relevant state practice acts, which mandate providing competent and safe care. The risk assessment approach is crucial here, as it involves systematically identifying potential harms and benefits associated with different courses of action. The correct approach represents best professional practice because it prioritizes a collaborative and informed decision-making process. By engaging the patient in a discussion about the risks and benefits of their preferred activity, the physical therapist upholds the principle of autonomy while also fulfilling their duty of care. This approach involves educating the patient about potential complications, alternative strategies, and the rationale behind the therapist's recommendations. It empowers the patient to make an informed choice, even if that choice differs from the therapist's initial recommendation, while ensuring the therapist has documented their professional opinion and the patient's decision. This aligns with the ethical guidelines of the American Physical Therapy Association (APTA) regarding informed consent and patient rights, as well as legal requirements to practice within the scope of competence and to avoid negligence. An incorrect approach that involves unilaterally refusing to allow the patient to engage in the activity, despite the patient's expressed desire and understanding of potential risks, fails to adequately respect patient autonomy. This could be seen as paternalistic and may violate the patient's right to self-determination, potentially leading to a breakdown in the therapeutic relationship and even legal repercussions if the patient feels their rights have been infringed. Another incorrect approach, which is to simply acquiesce to the patient's request without a thorough discussion of risks and benefits, neglects the therapist's ethical obligation of beneficence and their legal duty to provide safe and competent care. This could result in patient injury, for which the physical therapist could be held liable for negligence. Finally, an approach that involves dismissing the patient's concerns and proceeding with the activity without addressing their underlying anxieties or perceived benefits fails to acknowledge the patient's perspective and may not lead to optimal adherence or outcomes. The professional decision-making process for similar situations should involve 1. Identifying the core ethical and legal principles at play: autonomy, beneficence, non-maleficence, justice, scope of practice. 2. Gathering all relevant information about the patient's condition, goals, and preferences. 3. Conducting a thorough risk-benefit analysis of all potential interventions and patient-preferred activities. 4. Engaging in open and honest communication with the patient, explaining findings, recommendations, and potential consequences in understandable terms. 5. Collaboratively developing a plan of care that respects the patient's informed decisions while ensuring the therapist's professional judgment is exercised. 6. Documenting the entire process, including discussions, decisions, and rationale. Question 10. Risk assessment procedures indicate that a patient with a 10-year history of rheumatoid arthritis, who is currently undergoing a physical therapy program for functional mobility, reports a significant increase in bilateral knee pain, stiffness, and generalized fatigue over the past 48 hours. The patient denies any recent trauma or injury. What is the most appropriate initial course of action for the physical therapist? Option A. Advise the patient to rest completely and avoid all physical activity until their next scheduled physician appointment. Option B. Immediately refer the patient to their primary care physician for evaluation without performing any further physical therapy assessment. Option C. Conduct a comprehensive physical therapy re-examination, including vital signs, palpation for joint warmth and swelling, assessment of range of motion and functional limitations, and a review of any new systemic symptoms. Option D. Proceed with the planned exercise program as scheduled, assuming the increased pain is a typical fluctuation in their rheumatoid arthritis. The correct answer is C. Conduct a comprehensive physical therapy re-examination, including vital signs, palpation for joint warmth and swelling, assessment of range of motion and functional limitations, and a review of any new systemic symptoms. Explanation. Scenario analysis. This scenario presents a common challenge in physical therapy practice, managing a patient with a chronic, inflammatory condition like rheumatoid arthritis, RA, who is experiencing a flare-up. The challenge lies in differentiating between a typical RA exacerbation requiring modified activity and a more serious systemic issue or complication that necessitates immediate medical referral. The physical therapist must balance the need for continued rehabilitation and functional improvement with the imperative to avoid exacerbating the patient's condition or missing red flags. This requires a thorough understanding of RA pathophysiology, its common presentations, and the potential for secondary complications. Correct approach analysis. The correct approach, which involves a comprehensive assessment including vital signs, joint palpation for warmth and swelling, and a review of recent systemic symptoms, represents best professional practice. This aligns with the National Physical Therapy Examination's emphasis on evidence-based practice and patient safety. Specifically, it adheres to the APTA standards of practice for physical therapy and the Code of Ethics, which mandate that physical therapists provide safe and effective care, recognize their limitations, and consult with or refer to other professionals when appropriate. A thorough assessment allows the therapist to gather objective data to inform their clinical judgment, distinguishing between a manageable RA flare and a potential medical emergency. This systematic approach ensures that the patient receives the most appropriate level of care, prioritizing their well-being and preventing potential harm. Incorrect approach is analysis. One incorrect approach would be to proceed with the planned exercise program without further assessment, assuming the patient's report of increased joint pain is simply a typical fluctuation in their RA. This fails to uphold the ethical and professional obligation to assess the patient's current status thoroughly. It could lead to exacerbation of inflammation, increased pain, and potential joint damage, violating the principle of do no harm. This approach neglects the critical step of reassessment when a patient's presentation changes, a fundamental aspect of safe patient care. Another incorrect approach would be to immediately refer the patient to a physician for any report of increased joint pain, without conducting an initial physical therapy assessment. A physician referral is sometimes necessary. An immediate referral without a preliminary physical therapy evaluation can be inefficient and may delay appropriate management. It bypasses the physical therapist's role in initial assessment and differential diagnosis within their scope of practice. This approach fails to utilize the therapist's expertise to gather relevant information that might guide the referral or even indicate that the patient can continue with modified therapy. A third incorrect approach would be to rely solely on the patient's subjective report of pain without objective physical examination. While subjective reports are crucial, they must be corroborated and contextualized by objective findings. Ignoring objective signs like increased warmth, swelling, or systemic symptoms would be a failure to conduct a comprehensive evaluation, potentially missing critical indicators of a more serious condition. This approach is not aligned with the rigorous, evidence-based assessment standards expected of physical therapists. Professional reasoning. When a patient with a chronic inflammatory condition reports an exacerbation of symptoms, the professional decision-making process should begin with a thorough reassessment. This involves gathering subjective information about the nature, location, and severity of the new or worsened symptoms, as well as any associated systemic complaints. This is followed by objective measures, including vital signs, palpation for signs of inflammation, warmth, swelling, tenderness, range of motion assessment, and functional testing. The therapist must then synthesize this information to determine if the changes are consistent with the patient's known condition and within the expected variability, or if they suggest a new pathology, a complication, or a need for medical intervention. This clinical reasoning process, grounded in the principles of patient safety and evidence-based practice, guides the decision to continue, modify, or defer therapy, or to refer to another healthcare provider. Question 11. The evaluation methodology shows that a physical therapist is treating a patient for chronic low back pain. The patient's electronic health record indicates a new prescription for a medication that the physical therapist is unfamiliar with, and the record does not explicitly state the purpose of this medication in relation to the patient's current presentation or physical therapy plan. What is the most appropriate course of action for the physical therapist? Option A. proceed with the planned physical therapy interventions, assuming the medication is unrelated to the current treatment. Option B, discuss the medication with the patient and encourage them to research its effects online. Option C, consult with a colleague in the physical therapy department to interpret the medication's potential effects. Option D, contact the prescribing physician directly to clarify the medication's purpose and its potential impact on the physical therapy treatment plan. The correct answer is D. Contact the prescribing physician directly to clarify the medication's purpose and its potential impact on the physical therapy treatment plan. Explanation: this scenario presents a common challenge in interprofessional collaboration. Differing professional scopes of practice and communication breakdown leading to potential patient harm. The physical therapist's role is to assess and treat neuromuscular and musculoskeletal conditions, while the physician manages the overall medical diagnosis and treatment plan. Effective collaboration requires clear communication, mutual respect for each profession's expertise, and a shared commitment to the patient's well-being. The correct approach prioritizes direct, open communication with the physician to clarify the patient's diagnosis and the rationale behind the prescribed medication. This aligns with the ethical principle of patient advocacy and the regulatory expectation for physical therapists to practice within their scope and collaborate with other healthcare providers to ensure safe and effective care. By seeking clarification, the physical therapist upholds their responsibility to understand the full clinical picture and to ensure that their interventions are complementary and not contraindicated by the medical management. This proactive communication prevents potential adverse drug interactions or exacerbation of the patient's condition due to a misunderstanding of the medical plan. An incorrect approach would be to proceed with treatment without seeking clarification. This demonstrates a failure to advocate for the patient and a disregard for the potential impact of the medication on physical therapy interventions. It could lead to patient harm, such as adverse drug reactions or delayed recovery, and violates the ethical duty to provide competent care. Furthermore, it undermines the collaborative nature of healthcare, potentially creating a rift between the physical therapist and the physician. Another incorrect approach would be to assume the medication is for a condition unrelated to the patient's physical therapy needs, and to proceed with treatment without any communication. This is a significant ethical and regulatory failure. It ignores the interconnectedness of a patient's health and the potential for systemic effects of medications. Physical therapists are expected to be aware of and consider all relevant patient information, including prescribed medications, when developing and implementing treatment plans. Finally, an incorrect approach would be to discuss the patient's medication with the patient and attempt to interpret its purpose or contraindications without consulting the prescribing physician. While patient education is important, a physical therapist is not qualified to interpret or advise on the medical management of a patient's condition or prescribed medications. This oversteps the professional scope of practice and could lead to dangerous misinformation for the patient. The professional decision-making process in such situations involves 1. Identifying a potential conflict or lack of clarity in the patient's care plan. 2. Recognizing the need for interprofessional communication to resolve the ambiguity. 3. Prioritizing patient safety and advocacy by seeking direct clarification from the relevant healthcare professional. 4. Documenting all communication and actions taken. Question 12. Assessment of a patient's refusal to participate in a prescribed physical therapy exercise program, despite the therapist's clinical judgment that the exercises are essential for their recovery and safety, presents an ethical challenge. The patient, an independent adult, states they don't feel like doing it today and expresses a desire to rest instead. The physical therapist has previously educated the patient on the benefits of the exercises and the potential consequences of non-adherence. What is the most appropriate course of action for the physical therapist in this situation? Option A. Contact the patient's family without the patient's explicit consent to discuss the situation and seek their intervention to encourage participation. Option B. Engage in a detailed discussion with the patient to understand the reasons behind their refusal, explore their concerns, and re-educate them on the importance of the exercises, while also assessing their current capacity to make informed decisions about their care. Option C. Immediately proceed with the exercises, explaining to the patient that it is for their own good and that their current feelings are not a valid reason to impede their recovery. Option D. Document the patient's refusal and terminate the therapy session, advising the patient to reschedule when they are more willing to participate. Correct answer is B. Engage in a detailed discussion with the patient to understand the reasons behind their refusal, explore their concerns, and re-educate them on the importance of the exercises, while also assessing their current capacity to make informed decisions about their care. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the physical therapist's clinical judgment regarding their safety and functional capacity. The physical therapist must navigate the ethical principle of patient autonomy while upholding their responsibility to provide safe and effective care, adhering to the standards of practice outlined by the National Physical Therapy Examinations governing body. The core of the dilemma lies in determining when a patient's decision-making capacity is compromised to the extent that it necessitates overriding their autonomy for their own well-being. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and patient-centered evaluation. It involves a thorough assessment of the patient's understanding of their condition, the proposed treatment, and the potential risks and benefits, which aligns with the ethical obligation to ensure informed consent. Furthermore, it includes exploring the underlying reasons for the patient's refusal, seeking to understand their perspective and potential barriers to adherence, which is crucial for building therapeutic rapport and facilitating shared decision-making. Involving the patient's family or designated support person, with the patient's consent, can provide additional insight and support, further reinforcing a collaborative approach. This aligns with the National Physical Therapy Examinations' emphasis on patient-centered care and the ethical guidelines that mandate a therapist to act in the patient's best interest while respecting their rights. An incorrect approach that involves immediately overriding the patient's wishes without a comprehensive assessment of their decision-making capacity would be a significant ethical and regulatory failure. This action violates the principle of patient autonomy and could lead to a breakdown in the therapeutic relationship. It also fails to explore potential underlying issues that might be contributing to the patient's refusal, such as fear, misunderstanding, or unmet needs. Another incorrect approach, such as abandoning the patient due to their noncompliance without attempting to understand or address the reasons for refusal, would also be professionally unacceptable. This would constitute a failure to provide appropriate care and could be seen as a dereliction of duty, violating the ethical obligation to provide care within the scope of practice and to advocate for the patient's needs. A third incorrect approach, such as proceeding with treatment against the patient's explicit refusal without proper justification or documentation of impaired capacity, would be a direct violation of patient rights and could have legal ramifications, as well as being a breach of professional conduct. A professional decision-making process for similar situations should involve a structured approach. First, clearly identify the ethical conflict. Second, gather all relevant information about the patient's condition, their stated wishes, and their capacity to make decisions. Third, consult relevant ethical guidelines and professional standards. Fourth, engage in open and honest communication with the patient, exploring their rationale and addressing any concerns. Fifth, if decision-making capacity is in question, conduct a formal assessment or seek consultation. Sixth, involve appropriate support systems or healthcare professionals as needed. Finally, document the entire process, including the assessment, discussions, decisions, and rationale, to ensure accountability and transparency. Question 13. Comparative studies suggest that historical approaches to physical therapy often differed significantly from contemporary evidence-based practices. A patient, recalling treatments received decades ago, insists on a specific manual technique that is no longer considered a primary intervention in current physical therapy guidelines due to limited efficacy and potential risks. Physical therapist has reviewed the patient's current medical history and determined that this requested technique is not indicated and may be detrimental. How should the physical therapist proceed? Option A. Agree to perform the requested technique, acknowledging the patient's past experience, and then proceed with standard evidence-based treatments without further discussion of the requested technique. Option B. Politely decline the patient's request without further explanation, stating that only current protocols are followed. Option C. Implement the patient's requested manual technique as a gesture of good faith, while also incorporating current evidence-based interventions to ensure patient satisfaction. Option D. Educate the patient on current evidence-based treatment options. Explain the rationale for why the requested technique is not recommended based on current standards and potential risks, and collaboratively develop a treatment plan aligned with best practices. The correct answer is D. Educate the patient on current evidence-based treatment options. Explain the rationale for why the requested technique is not recommended based on current standards and potential risks, and collaboratively develop a treatment plan aligned with best practices. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the physical therapist to reconcile historical perspectives on patient care with current evidence-based practice and regulatory expectations. The patient's request, while rooted in a past understanding of physical therapy's role, directly conflicts with contemporary professional standards and the legal framework governing physical therapy practice. Navigating this requires not only clinical expertise, but also strong communication skills and an understanding of the evolution of the profession's scope and ethical obligations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and well-being by adhering to current evidence-based guidelines and regulatory requirements. This involves educating the patient about the rationale behind current treatment protocols, explaining the risks associated with outdated or unproven methods, and collaboratively developing a treatment plan that aligns with contemporary standards of care. This approach upholds the physical therapist's ethical duty to provide competent care and to act in the patient's best interest, as mandated by professional practice acts and ethical codes that emphasize evidence-based interventions and patient autonomy within safe and effective parameters. Incorrect approaches analysis. An approach that blindly follows the patient's request without critical evaluation fails to uphold the physical therapist's professional responsibility to provide safe and effective care. This would be a regulatory and ethical failure because it disregards established standards of practice and potentially exposes the patient to harm from unproven or outdated interventions. Violates the principle of beneficence and non-maleficence. An approach that dismisses the patient's request outright without attempting to understand its origin or provide a clear explanation of current practices is also professionally deficient. While adhering to current standards is crucial, a lack of empathetic communication and patient education can erode trust and lead to noncompliance. Ethically, this approach fails to respect patient autonomy and the therapeutic relationship, potentially violating principles of patient-centered care. An approach that attempts to compromise by incorporating elements of the outdated practice without a clear evidence-based rationale is problematic. This could lead to a diluted or ineffective treatment plan, potentially delaying recovery or even causing harm. It represents a failure to adhere to the principle of providing the most effective care supported by current scientific understanding and regulatory guidance. Professional reasoning. Professionals should approach such situations by first actively listening to and acknowledging the patient's perspective and concerns. Then, they must critically evaluate the patient's request against current evidence-based practice, professional standards, and regulatory requirements. The next step involves clear, empathetic communication, explaining the rationale for current practices and the potential risks of alternative approaches. Finally, a collaborative treatment plan should be developed, ensuring patient understanding and informed consent, while always prioritizing safety and efficacy within the legal and ethical framework of physical therapy practice. Question 14. The control framework reveals a physical therapist is evaluating a patient diagnosed with multiple sclerosis, MS, presenting with progressive gait instability and fatigue. The patient reports difficulty navigating their home and community, impacting their independence. Considering the pathophysiological underpinnings of MS, which of the following approaches best aligns with current evidence-based practice and ethical consideration for managing this patient's functional limitations? Option A. Recommend a complete cessation of physical activity to prevent exacerbation of fatigue and neurological symptoms. Option B. Implement a progressive resistance exercise program to maximize muscle strength, aiming to compensate for neurological deficits. Option C. Primarily utilize passive modalities such as heat and electrical stimulation to alleviate muscle stiffness and improve circulation. Option D. Focus on a comprehensive assessment of gait and balance impairments, incorporating functional mobility training, energy conservation techniques, and patient education on symptom management. The correct answer is B. Implement a progressive resistance exercise program to maximize muscle strength, aiming to compensate for neurological deficits. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of managing a patient with a chronic, progressive neurological condition like multiple sclerosis, MS. The challenge lies in balancing the patient's immediate functional needs with the long-term implications of disease progression, potential exacerbations, and the need for a multidisciplinary approach. Physical therapists must integrate their understanding of MS pathophysiology with evidence-based practice to develop a safe, effective, and individualized treatment plan. This requires careful consideration of the patient's current symptoms, functional limitation, potential for change, and the impact of interventions on disease trajectory. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that directly addresses the patient's reported functional deficits and considers the underlying pathophysiological mechanisms of MS. This aligns with the core principles of physical therapy practice as outlined by the American Physical Therapy Association, APTA, Standards of Practice and Code of Ethics. Specifically, it emphasizes patient-centered care, evidence-based practice, and the therapist's responsibility to understand the disease process to inform treatment. By focusing on improving gait, balance, and functional mobility, while also educating the patient on energy conservation and symptom management, the therapist is directly addressing the functional consequences of demyelination and axonal damage in MS. This approach is ethically sound as it respects patient autonomy by involving them in goal setting and education, and it upholds the professional obligation to provide competent care based on a thorough understanding of the condition. Incorrect approach is analysis, an approach that solely focuses on aggressive strengthening exercises without considering the potential for fatigue and exacerbation in MS would be a regulatory and ethical failure. This disregards the pathophysiological hallmark of fatigue in MS, which can be exacerbated by overexertion, leading to functional decline and potential harm. This violates the principle of do no harm, non-maleficence, and fails to adhere to evidence-based guidelines for MS management, which advocate for graded exercise and energy conservation. An approach that neglects to assess or address the patient's psychosocial well-being and social support systems, despite their significant impact on adherence to treatment and overall quality of life in chronic conditions like MS, would also be a professional failing. While not directly a pathophysiology intervention, neglecting these factors can indirectly impede functional recovery and adherence to a management plan, thus not providing holistic care. This could be seen as a failure to meet the broader ethical obligation to consider the patient's overall well-being and to facilitate optimal outcomes. An approach that relies solely on passive modalities without active engagement from the patient in functional retraining would be a significant deviation from best practice. While modalities may offer temporary symptom relief, they do not address the underlying neuromuscular deficits or promote long-term functional adaptation. This approach fails to empower the patient and is not aligned with the active, rehabilitative nature of physical therapy for chronic neurological conditions, potentially leading to a lack of progress and patient dissatisfaction, and not fully utilizing the therapist's scope of practice. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the patient's condition, including its pathophysiology. This understanding informs the assessment, which should be comprehensive and patient-centered, identifying specific functional limitations and impairments. Evidence-based practice guidelines for the specific condition should then be consulted to guide the selection of intervention. A collaborative approach, involving the patient in goal setting and education, is crucial for adherence and optimal outcomes. Regular reassessment and modification of the treatment plan based on the patient's response and disease progression are essential components of ongoing professional responsibility. Question 15. To address the challenge of a patient reporting significant pain and fatigue during the initial screening for a physical therapy examination, what is the most appropriate approach to proceed with the evaluation process? Option A. Proceed with a full, standardized examination as per protocol, assuming the patient will adapt as the examination progresses. Option B. Terminate the examination immediately due to the patient's reported limitations, rescheduling for a later date when the patient feels better. Option C. Conduct a modified examination, prioritizing subjective reports and observed responses, and adjusting the sequence and intensity of tests based on the patient's tolerance. Option D. Focus solely on objective measures of range of motion and strength, downplaying the subjective reports of pain and fatigue. The correct answer is C. Conduct a modified examination, prioritizing subjective reports and observed responses, and adjusting the sequence and intensity of tests based on the patient's tolerance. Explanation. Scenario analysis. This scenario presents a professional challenge because the physical therapist must balance the need for comprehensive evaluation with the patient's immediate functional limitations and potential for exacerbation of symptoms. The patient's report of pain and fatigue during initial screening necessitates a cautious and adaptive approach to the examination process. Failing to adequately assess the patient's current capacity could lead to overexertion, increased pain, and a compromised therapeutic relationship, while also potentially delaying accurate diagnosis and intervention. Correct approach analysis. The correct approach involves a systematic yet flexible examination, prioritizing the patient's subjective report and observed responses. This aligns with best professional practice as outlined by the American Physical Therapy Association, APTA, Standards of Practice for Physical Therapy, and the Guide to Physical Therapist Practice. These documents emphasize patient-centered care, which includes modifying examination procedures based on the patient's tolerance and response. A therapist must gather sufficient subjective and objective data to formulate a diagnosis and plan of care, but this must be done in a manner that respects the patient's current limitations and avoids causing undue harm or distress. This approach ensures the examination is both thorough and safe, leading to a more effective and ethical treatment plan. Incorrect approaches analysis. One incorrect approach would be to proceed with a full, standardized examination without modification, despite the patient's reported pain and fatigue. This disregards the patient's subjective experience and the principle of avoiding harm, potentially violating ethical guidelines that mandate patient safety and well-being. It also fails to adhere to the APTA emphasis on individualized care, as a rigid adherence to a protocol without considering the patient's presentation is not patient-centered. Another incorrect approach would be to terminate the examination prematurely based solely on the initial report of pain and fatigue, without attempting to gather any objective data or explore the nature of the limitations. This would be a failure to perform a reasonably thorough examination, potentially leading to an incomplete or inaccurate diagnosis and an ineffective plan of care. It could also be seen as a lack of professional diligence, as the therapist has not made a reasonable effort to assess the patient's condition. A third incorrect approach would be to focus exclusively on objective measures, without adequately incorporating the patient's subjective reports of pain and fatigue into the interpretation of findings. This could lead to misinterpretation of objective data, as pain and fatigue can significantly influence functional performance. Ethical practice requires integrating all available information, both subjective and objective, to form a holistic understanding of the patient's condition. Professional reasoning. When faced with a patient reporting pain and fatigue during an initial screening, a physical therapist should employ a clinical reasoning process that prioritizes patient safety and a thorough, yet adaptable examination. This involves 1. Actively listening to and validating the patient's subjective reports. 2. Performing a modified examination, starting with less demanding assessments and progressing cautiously, observing the patient's response at each step. 3. Utilizing a combination of subjective questioning and objective measures to understand the nature, intensity, and impact of the pain and fatigue. 4. Documenting all findings, including the patient's responses to examination maneuvers and the rationale for any modifications made. 5. Collaborating with the patient to establish realistic goals and a treatment plan that respects their current capacity. This iterative process ensures that the examination is both informative and safe, forming the foundation for effective physical therapy intervention. Question 16. The monitoring system demonstrates a sustained decrease in the patient's Glasgow Coma Scale score by 2 points over the last hour, accompanied by a new onset of nystagmus and a subjective report of increased dizziness from the patient, who is 48 hours post-craniotomy for a tumor resection. The physical therapist has been performing gentle range of motion exercises as per the established plan of care. Option A. Reassure the patient that these symptoms are common post-operative effects and continue with the current physical therapy program. Option B. Document the findings and suggest the patient rest in bed until the next scheduled therapy session. Option C. Continue with the planned physical therapy interventions, documenting the patient's subjective complaints and objective findings for the next physician update. Option D. Immediately contact the supervising physician to report the changes in the patient's neurological status and request further medical evaluation. The correct answer is D. Immediately contact the supervising physician to report the changes in the patient's neurological status and request further medical evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the subtle yet significant changes in a patient's neurological status. The physical therapist must interpret complex, objective data from a monitoring system and correlate it with subjective patient reports and clinical observations. The challenge lies in distinguishing between normal post-operative fluctuations and emergent signs of a serious complication, requiring a high degree of clinical reasoning and adherence to establish protocols for patient safety and effective care. Correct approach analysis. The correct approach involves immediate and direct communication with the supervising physician. This aligns with the National Physical Therapy Examination's emphasis on patient safety and the physical therapist's role as a member of the healthcare team. Regulations and ethical guidelines mandate that physical therapists recognize and respond to changes in patient condition that may indicate a medical emergency or require medical intervention. Promptly notifying the physician ensures that the patient receives timely medical evaluation and management, preventing potential harm and optimizing outcomes. This also reflects the principle of acting within the scope of practice and collaborating with other healthcare professionals. Incorrect approaches analysis. One incorrect approach involves continuing with the planned physical therapy intervention without further medical consultation. This fails to acknowledge the potential severity of the observed neurological changes. Ethically, this could be considered a breach of the duty of care, as it prioritizes the planned treatment over the patient's immediate well-being. Regulatory frameworks emphasize the therapist's responsibility to monitor patient response and modify or discontinue treatment if adverse effects occur, and to seek appropriate medical guidance when necessary. Another incorrect approach is to document the findings and wait for the next scheduled physician update. This delays critical medical assessment and intervention. This approach violates the principle of timely reporting of significant clinical changes, which is a cornerstone of patient safety and effective healthcare delivery. Regulations typically require prompt reporting of any findings that could compromise patient health or safety. A further incorrect approach is to reassure the patient that the symptoms are normal post-operative effects without verifying this with the physician. While patient reassurance is important, it must be based on accurate clinical assessment and medical consensus. Making assumptions about the cause of neurological changes without physician consultation can lead to a failure to identify and treat a serious condition, potentially resulting in adverse patient outcomes and violating professional standards of care. Professional reasoning. Professionals should employ a systematic decision-making process when faced with changes in patient status. This involves 1. Recognizing and objectively documenting the observed changes. 2. Correlating these findings with the patient's subjective report and medical history. 3. Consulting relevant clinical guidelines and protocols. 4. Determining the urgency of the situation. 5. Communicating findings and concerns promptly and clearly to the appropriate healthcare provider, in this case, the supervising physician. 6. Documenting all actions taken and communications. This structured approach ensures that patient safety is paramount and that care is delivered in accordance with professional standards and regulatory requirements. Question 17. The evaluation methodology shows a patient presenting with exertional dyspnea and occasional sharp pleuritic chest pain. The physical therapist is considering the anatomical structures involved in respiration and circulation. Which of the following best guides the therapist's initial assessment strategy based on the anatomy of the heart and lungs? Option A. Focus primarily on the pericardium and myocardium to rule out primary cardiac ischemia, as exertional dyspnea can be a cardiac equivalent. Option B. Prioritize assessment of the diaphragm and intercostal muscles for respiratory mechanics, while also considering the potential for pulmonary embolism affecting the pulmonary vasculature. Option C. Evaluate the bronchial tree and pleural membranes for inflammation or irritation, as these directly relate to pleuritic chest pain and dyspnea. Option D. Assess the cardiac valves and great vessels for structural abnormalities that might impede blood flow and cause referred pain. The correct answer is B. Prioritize assessment of the diaphragm and intercostal muscles for respiratory mechanics, while also considering the potential for pulmonary embolism affecting the pulmonary vasculature. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a physical therapist to integrate knowledge of cardiac and pulmonary anatomy with clinical presentation to accurately assess a patient's condition. Misinterpreting the anatomical basis of symptoms can lead to delayed or incorrect diagnosis, inappropriate treatment, and potential harm to the patient. The challenge lies in differentiating between primary cardiac and pulmonary issues, as their symptoms can overlap, and understanding how anatomical structures contribute to these presentations. Correct approach analysis. The correct approach involves a systematic evaluation that begins with understanding the patient's reported symptoms in the context of cardiac and pulmonary anatomy. This includes considering the location and nature of chest pain, e.g., substernal radiating pleuritic, the presence and character of dyspnea, e.g., exertional, positional, and any associated signs like edema or cough. The physical therapist must then correlate these findings with the known functions and anatomical relationships of the heart chambers, valves, coronary arteries, and lungs, bronchi, alveoli, pleura. This integrated approach aligns with the National Physical Therapy Examination's emphasis on evidence-based practice and the application of foundational scientific knowledge to clinical reasoning, ensuring patient safety and effective intervention. Incorrect approaches analysis. An approach that focuses solely on musculoskeletal causes of chest pain without considering cardiac or pulmonary origins is professionally unacceptable. This failure violates the ethical obligation to conduct a comprehensive assessment and could lead to missing a life-threatening cardiac event. It demonstrates a lack of understanding of referred pain patterns and the interconnectedness of body systems, which is a fundamental expectation for physical therapists. An approach that prioritizes pulmonary assessment without adequately investigating potential cardiac etiologies for dyspnea or chest discomfort is also professionally unsound. This oversight can result in a misdiagnosis of myocardial infarction or heart failure, leading to delayed critical medical management. It reflects an incomplete application of anatomical and physiological knowledge, failing to consider the differential diagnoses that are crucial for patient well-being. An approach that relies on patient self-reporting of symptoms without objective anatomical correlation or consideration of underlying pathophysiology is insufficient. While patient history is vital, it must be critically analyzed against anatomical and physiological principles. This approach risks accepting subjective complaints at face value without the necessary clinical reasoning to identify potentially serious underlying conditions. Professional reasoning. Professionals should employ a systematic clinical reasoning process that begins with a thorough subjective and objective examination. This process involves hypothesis generation based on patient presentation, followed by testing these hypotheses through further assessment and consideration of anatomical and physiological principles. When symptoms suggest potential cardiac or pulmonary involvement, the physical therapist must recognize the limits of their scope of practice and the necessity of appropriate referral to physicians for definitive diagnosis and management of these complex systems. This ensures patient safety and adherence to professional standards of care. Question 18. Cost-benefit analysis shows that providing intensive, task-specific motor learning intervention with varied feedback schedules for a patient recovering from a stroke is most likely to yield significant functional gains. However, the patient's insurance policy limits coverage for physical therapy to 2 visits per week for a maximum of 6 weeks, which the therapist believes is insufficient to achieve optimal motor control recovery. The therapist has documented the patient's progress and the rationale for continued therapy. What is the most appropriate course of action? Option A. Bill for additional therapy sessions under a different CPT code that is not directly related to the patient's motor control deficits to circumvent the insurance limitations. Option B. Inform the patient that therapy must cease after 6 weeks due to insurance limitations, regardless of their functional status or potential for further improvement. Option C. Reduce the frequency and duration of therapy sessions to strictly adhere to the insurance policy's limits, even if it means compromising the effectiveness of the motor learning interventions. Option D. Submit a detailed request for pre-authorization or initiate an appeal with the insurance company, providing comprehensive documentation of medical necessity, functional goals, and the evidence-based rationale for the proposed treatment intensity and duration, emphasizing the principles of motor control and learning. The correct answer is D. Submit a detailed request for pre-authorization or initiate an appeal with the insurance company, providing comprehensive documentation of medical necessity, functional goals, and the evidence-based rationale for the proposed treatment intensity and duration, emphasizing the principles of motor control and learning. Explanation. Scenario analysis. This scenario presents a common challenge in physical therapy, balancing the desire for optimal patient outcomes with the practical constraints of insurance reimbursement and available resources. The physical therapist must advocate for the patient's needs while adhering to the established guidelines of the payer, which can sometimes be misaligned with the therapist's clinical judgment regarding the most effective motor control and learning strategies. The challenge lies in ethically and effectively communicating the value of specific interventions that may not be explicitly covered or are limited in duration by the insurance policy. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient-centered care and evidence-based interventions within the regulatory framework of physical therapy practice in the United States. The physical therapist is ethically and professionally obligated to advocate for the patient's functional recovery. This involves clearly articulating the rationale for continued therapy, specifically linking the proposed interventions, e.g., task-specific training, feedback strategies, to the patient's goals and the principles of motor control and learning. This approach aligns with the American Physical Therapy Association's APTA Code of Ethics, which emphasizes the importance of patient welfare and professional integrity. Furthermore, it adheres to the Medicare Part B guidelines and other payer policies that require documentation demonstrating medical necessity and functional improvement. By seeking pre-authorization and providing a detailed justification, the therapist is proactively addressing potential barriers to care and ensuring that the patient receives the most appropriate and beneficial treatment. Incorrect approaches analysis. One incorrect approach involves accepting the insurance denial without further action. This fails to uphold the physical therapist's ethical duty to advocate for their patient and may result in suboptimal functional outcomes for the patient. It also disregards the potential for appeal processes and the possibility that the initial denial was based on a misunderstanding or incomplete information, violating the principle of acting in the patient's best interest. Another incorrect approach is to unilaterally reduce the frequency or intensity of therapy to fit within the insurance limitations, without a clear clinical rationale. This could compromise the effectiveness of the motor learning strategies being employed, as optimal motor learning often requires sufficient repetition and appropriate feedback, which may be disrupted by arbitrary reductions in treatment. This approach prioritizes financial expediency over patient benefit and may violate professional standards of care. A third incorrect approach is to bill for services that are not medically necessary or are outside the scope of physical therapy practice to circumvent insurance limitations. This constitutes fraudulent billing practices, which are illegal and unethical, and can lead to severe penalties for the therapist and the practice. It undermines the integrity of the profession and erodes public trust. Professional reasoning. Professionals should approach such situations by first thoroughly understanding the patient's functional deficits and goals, and then identifying the most effective motor control and learning strategies to address them, supported by current evidence. They must then familiarize themselves with the specific payer's policies and reimbursement guidelines. When a conflict arises, the professional decision-making process involves 1. Documenting the clinical rationale for the proposed treatment, clearly linking it to functional outcomes and motor learning principles. 2. Communicating with the patient about the insurance limitations and the proposed plan to address them. 3. Initiating the appeals process or seeking pre-authorization with comprehensive documentation supporting medical necessity. 4. Exploring alternative treatment strategies or community resources if continued therapy is not feasible. This systematic approach ensures that patient care remains paramount while navigating the complexities of the healthcare system. Question 19. Consider a scenario where a patient presents with a distal radius fracture and associated significant soft tissue swelling and bruising in the forearm. The physical therapist's initial assessment reveals limited wrist and finger range of motion due to pain and edema. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for physical therapists in managing this patient? Option A. Focus solely on immobilizing the affected limb to ensure optimal fracture healing, deferring any soft tissue interventions until the fracture is clinically stable. Option B. Conduct a comprehensive assessment of both the fracture and soft tissue injury. Develop an individualized treatment plan that addresses pain, edema, and mobility deficits, and educate the patient on precautions and self-management strategies. Option C. Implement a treatment plan that prioritizes aggressive range of motion exercises for the wrist and fingers to regain mobility quickly, while applying heat to reduce swelling. Option D. Utilize modalities such as ultrasound and electrical stimulation to reduce pain and inflammation without a specific functional goal, assuming these will indirectly aid in recovery. The correct answer is C. Implement a treatment plan that prioritizes aggressive range of motion exercises for the wrist and fingers to regain mobility quickly, while applying heat to reduce swelling. Explanation: this scenario presents a professional challenge due to the inherent complexity of managing a patient with both a fracture and soft tissue injury, requiring a comprehensive and evidence-based approach. The physical therapist must navigate the delicate balance between promoting fracture healing and addressing the surrounding soft tissue trauma, while adhering to the established scope of practice and ethical guidelines. Careful judgment is required to ensure the patient receives safe and effective care that optimizes functional recovery and minimizes the risk of complications. The correct approach represents best professional practice because it prioritizes a thorough initial assessment, including a detailed history, physical examination, and review of diagnostic imaging, to accurately diagnose the extent of both the fracture and soft tissue injury. This forms the foundation for developing an individualized, evidence-based treatment plan that integrates appropriate interventions for both conditions. Adherence to the National Physical Therapy Examinations regulatory framework emphasizes the importance of utilizing current best practices, patient-centered care, and interprofessional collaboration when necessary. This approach ensures that the patient's unique needs and goals are met, promoting optimal outcomes and minimizing the risk of adverse events. An incorrect approach that involves solely focusing on the fracture and neglecting the soft tissue injury would be a regulatory and ethical failure. This oversight could lead to delayed healing of the soft tissues, increased pain, inflammation, and potentially chronic dysfunction, directly contravening the physical therapist's duty to provide comprehensive care. Another incorrect approach, such as applying modalities without a clear rationale or without considering their impact on both the fracture and soft tissue, demonstrates a lack of evidence-based practice and could exacerbate the patient's condition, violating professional standards of care. Furthermore, failing to document the assessment and treatment plan thoroughly would be a significant regulatory failure, hindering communication with other healthcare providers and potentially exposing the therapist to liability. Professional decision-making in similar situations should involve a systematic process. 1. Gather comprehensive patient information, including history, symptoms, and diagnostic findings. 2. Perform a thorough physical examination to assess all affected structures. 3. Formulate a differential diagnosis and identify the primary impairments. 4. Develop a treatment plan based on evidence-based practice, considering the interplay between the fracture and soft tissue injury. 5. Implement interventions safely and effectively, continuously monitoring the patient's response. 6. Document all findings, interventions, and patient progress meticulously. 7. Collaborate with the interprofessional team as needed. 8. Reassess and modify the treatment plan as indicated by the patient's progress and changing clinical presentation. Question 20. The investigation demonstrates a patient presenting for physical therapy with a resting heart rate of 95 beats per minute, a respiratory rate of 22 breaths per minute, and oxygen saturation of 92% on room air. The patient reports mild shortness of breath with exertion during the initial assessment. Option A. Proceed with the planned physical therapy intervention as the findings are within acceptable limits for a deconditioned individual. Option B. Immediately discontinue physical therapy and refer the patient to a cardiologist for further management. Option C. Focus solely on respiratory exercises to improve oxygen saturation and disregard the elevated heart rate. Option D. Recommend further medical evaluation to rule out underlying cardiopulmonary pathology before proceeding with physical therapy. The correct answer is D. Recommend further medical evaluation to rule out underlying cardiopulmonary pathology before proceeding with physical therapy. Explanation. Scenario analysis. This scenario presents a professional challenge because the physical therapist must interpret physiological data in the context of a patient's potential cardiopulmonary compromise. The therapist needs to assess the risk of exacerbating the patient's condition through exercise, requiring a nuanced understanding of how circulatory and respiratory systems respond to physical stress and the implications of abnormal findings. This demands careful judgment to balance therapeutic benefit with patient safety, adhering to established practice guidelines and ethical obligations. Correct approach analysis. The correct approach involves a comprehensive risk assessment that integrates the observed physiological data with the patient's overall clinical presentation and medical history. This aligns with the National Physical Therapy Examination's emphasis on evidence-based practice and patient safety. Specifically, it requires the therapist to consider the potential for the observed findings to indicate underlying pathology that could be worsened by physical activity. This approach prioritizes patient well-being by advocating for further medical evaluation to ensure the patient is medically stable for physical therapy intervention, thereby adhering to the principle of do no harm and the ethical obligation to practice within the scope of physical therapy. Incorrect approaches analysis. One incorrect approach would be to proceed with the planned physical therapy intervention without further investigation, assuming the findings are benign or unrelated to the patient's exercise tolerance. This fails to acknowledge the potential severity of the physiological abnormalities and could lead to patient harm, violating ethical principles and potentially regulatory guidelines that mandate a thorough patient assessment and risk management. Another incorrect approach would be to immediately discontinue all physical therapy and discharge the patient without consulting the referring physician or seeking further medical evaluation. This is overly cautious and may deprive the patient of necessary rehabilitation. It also represents a failure to collaborate with the healthcare team and to exercise professional judgment in determining the appropriate course of action based on a comprehensive assessment. A third incorrect approach would be to focus solely on the respiratory findings and ignore the circulatory implications, or vice versa. This demonstrates a fragmented understanding of the interconnectedness of the cardiopulmonary system and a failure to conduct a holistic risk assessment, which is essential for safe and effective patient care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient history and physical examination, including the interpretation of objective physiological data. And concerning findings emerge, the process involves 1. Identifying potential risks to the patient's safety and well-being. 2. Consulting relevant clinical guidelines and evidence-based literature. 3. Collaborating with the referring physician and other healthcare professionals. 4. Documenting all findings, assessments, and decisions. And 5. Reevaluating the patient's status regularly. This iterative process ensures that interventions are safe, effective, and tailored to the individual patient's needs, while upholding professional and ethical standards.